ESGE and ESGE-ENA Position Statement on Gastrointestinal Endoscopy and COVID-19, Updated Guidance for the Era of Vaccines and Viral Variants. Introduction. The ongoing COVID-19 pandemic has entered a new phase following the introduction and availability of highly effective vaccination therapies that have modified the epidemiology of severe disease. Conversely, viral variants, e.g. the Delta variant, with increased transmissibility have developed and become dominant drivers of the pandemic in Europe and throughout the world. This has led to uncertainty regarding infection prevention, viral control strategies, and vaccination regimens. In Europe, as of October 2021, vaccination rollout with complete double-dose immunization status has reached 73.5% of the population, although with a high inter-country variability ranging from 25% to 95%. In some countries, the administration of a third booster dose has been initiated for individuals considered at high risk of negative outcomes from COVID-19. It must also be noted that currently COVID-19 vaccination rollout is highly imbalanced between high and low-income countries, with vaccinated population percentages in the latter being as low as 1%. This has prompted a flow of vaccines into these areas of the world where strategies for endoscopy resumption and procedure scheduling should be adapted to local epidemiology and regional risk stratifications. For such affected regions of the world, please refer to World Health Organization, WHO, guidelines and guidance documents from the European Society of Gastrointestinal Endoscopy and to the European Society of Gastroenterology and Endoscopy Nurses and Associates, ESGE, ESGE-ENA, and their adaptations to low-resource settings. Despite the worldwide introduction of COVID-19 vaccinations, gastrointestinal, GI, endoscopy continues to entail a significant risk of infection and morbidity from COVID-19 for both healthcare professionals, HCPs, and patients. Infection Prevention and Control, IPC, has been shown to be dramatically effective in assuring the safety of both patients and HCPs. ESGE and ESGE-ENA continue to join forces in this updated position statement to provide ongoing guidance during the pandemic to help assure the highest level of GI endoscopy care and protection against COVID-19 for both our patients and endoscopy unit personnel. This guidance is based upon the best available evidence in the current context of COVID-19 vaccines and SARS-CoV-2 viral variants. Recommendations. Selection. ESGE, ESGE-ENA recommend that infection prevention and control, IPC, regimens recommended in their previous COVID-19 position statements remain in place. This applies to patient triage, IPC training, social distancing, mask wearing, patient isolation, separation, role of telemedicine, personal hygiene, disinfection, and appropriate use of personal protective equipment, PPE. ESGE, ESGE-ENA recommend that where there are shortages of filtering facepiece, FFP, or KN95 masks, it is reasonable to use a standard surgical mask when performing endoscopy, upper and or lower GI endoscopy procedures, in patients who have negative polymerase chain reaction, PCR, or isothermal nucleic acid amplification, INAAT testing, within 48 hours before their endoscopy examination, or who provide documentation of full COVID-19 vaccination status or recovery from COVID-19 infection within the past 6 months, e.g. the European Union Digital COVID Certificate. Other PPE, e.g. gloves, hair cover, protective eyewear, waterproof gowns, booties, shoe covers, should continue to be used as recommended in our previous position statements. ESGE, ESGE-ENA recommend that all patients arriving at the GI endoscopy unit be required to wear masks and observe social distancing. ESGE, ESGE-ENA recommend that all patients presenting for GI endoscopy be required to provide either A, a negative viral test, PCR or INAAT, performed within 48 hours before their scheduled GI endoscopy, or B, documentation of full COVID-19 vaccination status or recovery from COVID-19 infection within the past 6 months, e.g. European Union Digital COVID Certificate. ESGE, ESGE-ENA do not recommend prioritization based on COVID-19 immunity status of patients awaiting GI endoscopy since this does not appear to be ethical. ESGE, ESGE-ENA recommend that pre-endoscopy viral testing, PCR or INAAT, be performed immediately in all symptomatic patients. Where viral testing is negative, patients may undergo GI endoscopy, thus avoiding postponement of procedures. ESGE, ESGE-ENA do not recommend the use of serology or rapid antigen testing, including home self-testing kits, for pre-endoscopy patient triage.